Welcome back to the Austin Physio YouTube channel. Today we're going to be looking at why am I getting pain in my wrist. We get a huge number of clients coming to see us in clinic reporting wrist pain, stiffness and soreness. So today we're going to break down some of the most common conditions that trigger pain and soreness in this area. Number one, the first thing we're going to be looking at is damage to your TFCC, your triangular fibrocartilaginous complex. This is a structure that is located on the ulnar side of your wrist, and it has key roles in stability of your distal radial ulnar joint, as well as stability into that ulnar aspect. It is made up of deep and superficial radial ulnar ligaments, as well as ligaments attaching on that medial side to the ulnar medial ligaments on that side, as well as a disc within the structure. What typically happens if someone has injured the TFCC, they've either fallen, typically on an outstretched hand, or the wrist has been pushed into an excessive ulnar deviation, or everything's been pulled, so any kind of trauma into that area. It can cause damage and inflammation into the disc and the ligaments, and so can be incredibly painful. What they typically see as well with quite a high percentage is there can also be associated with fractures of the radial head. So a lot of the time when people are presenting pain in this area, they're reporting having difficulty with gripping or lifting. So if they do any weight training, they might report that that's really difficult, or even carrying stuff can be incredibly sore. Typically when you push around the area or you deviate, so when you're testing, that typically triggers the pain as well. So what's really common if someone's coming in, if it's just happened and it's incredibly painful, the first step is you want to have it imaged, get it assessed properly, to have a look at the severity of damage in terms of damage to the bones and the ligaments around that area. Once we've ruled in or ruled out any severity, but ruled in the level of injury into this area, we then want to either look at anti-inflammatory or conservative treatment to help allow this area to recover and then regaining movement, or if it's really severe, we might need to refer on for surgery or other modalities of treatment to help repair this area. Number two, we are going to be addressing wrist sprains. So we have lots of people coming in saying, oh, I've sprained my wrist, or, you know, I think I've stretched my wrist, or something's happened that's damaged around this area. So we get this diagnosis of wrist sprains going around all the time. So what does it actually mean? What does it mean to sprain your wrist? So a wrist sprain is when we damage the main ligaments around this area. So it's either the ligaments between the tiny carpal bones of the wrist here, or the ligaments attaching between the proximal carpal bones and the radius and the ulnar. So the most common types of injury, again, might be falling on an outstretched hand. If the wrist has been pulled or pushed into an abnormal position, like with most trauma, it could be a pulled injury. So if the hand's been pulled, if you're hanging on to something and it suddenly pulls the wrist, or potentially, although less likely, could be repetitive patterns of motion over time, like a repetitive strain that's caused damage or soreness into this area. So first of all, we want to measure and look at the grading. So we're thinking, is it just that it's been aggravated, there's inflammation around there? Is it that we've had a partial tear, or is it that we've had a complete tear? So we're looking to see if it's minor to a major injury. So that's the first thing we want to be looking at. The second thing we definitely want to rule out, particularly if it's been pressure on a fallen outstretched hand or some kind of trauma to the wrist, similar to what we would look at with an ankle sprain, you want to rule out any damage or fracture to the bones. So most of the time when someone's sprained their wrist and it's obviously very sore, a lot of the time they go to A&E or they get it checked out straight away to make sure that nothing has been fractured. If that's been ruled out and it's a mild strain into the wrist, normally what people report is the wrist feeling really weak, really sore. It might be quite a diffuse pain around that area if lots of other structures are damaged as well. It's normally worse if you're stretching maybe away from where the ligament is, so you're stretching the fibres. It can also report weakness. They can report weakness into the hand and the wrist. So when we're thinking of acute management, first of all, we want to find out, okay, well, whereabouts is the injury? Which ligament do we feel like is involved? We want to look around to see if any other structures are sore as well, so into the muscle bellies or the tendons around this area. Have they been injured with the ligament strain? And then finally, when we're thinking of rehab, the most important first step is like RICE, so rest, ice, compression. We want to make sure we're taking away that inflammation. Then once that's started to heal, we then want to regain movement, and then after that looking at the strengthening. So really important to do it very methodically, where you're working out the level of severity, working out if another specialist needs to be involved, then looking at the rehab process and then tracking it very carefully over time. So the third thing that we want to be talking about is carpal tunnel syndrome. So again, when we talk to people about their case histories or they're coming in for an initial appointment, a lot of people say, I've got carpal tunnel syndrome, I've got carpal tunnel, and sometimes they're right, that has been diagnosed, and other times it's that self-diagnosis. So we want to talk about what it actually means to have this today and why it's linked to getting pain in the wrist. So your carpal tunnel is here made up of your carpal bones, your flexor retinaculum, so your transverse carpal ligament going over the top. With inside this tunnel, we have your flexor tendons to the fingers and the thumb, as well as your median nerve, which is what's relevant here. Your median nerve passing underneath to supply these three fingers with sensation, as well as power into the fingers, particularly into flexion, as well as movement of the thumb. So the reason why it's relevant when we're thinking about wrist pain, if someone's had like a repetitive injury where this has caused this area to become quite tight, or they've had that trauma into the wrist, or there might be other physiological conditions that are going on, so any kind of swelling around the wrist, i.e. during pregnancy, or anything where they're getting kind of pitting around the wrist, so swelling, so we're thinking anything to do with the heart and stuff like that, that can start to cause compression around this area. So what people report is weakness, typically into the hand, if we think it's been there for a while. Normally the initial first symptoms is pain around the wrist area, so it feels like almost like a burning, quite a sore pain around the wrist. They can almost reproduce the pain when they're pushing around the area. But what differentiates this from other conditions is that aggravation of the median nerve. So that tingling, that numbness, either that paresthesia or dysthesia, so it's either going to feel different or numb over these three fingers, is normally associated with the pain into the wrist. So what we want to look at, where it is this entrapment neuropathy, so the nerves getting trapped here, we want to test around that area to benchmark that sensation change as well as the power. But also what we want to look at as well is something called a double crush lesion. So all that fancy word means is if it's being aggravated at the wrist, it's very common that the median nerve can also be aggravated at other points that it passes through as it goes down into the wrist. So we're thinking around kind of the flexor and the pronator tendons up through here, as we're coming up here under pec minor and then up into the neck as well. So what we would look at in clinic is all these different points to see if that's making or aggravating the pain or making it worse. We would then want to benchmark the severity of the injury, get the area moving, soften around that area, look to see if conservative treatment is relevant for this person, or if it's not healing, not responding, you would want to refer on to see if any other possible decompression surgery or any other treatments might be more relevant for this person. As always, we have supplementary videos to cover all of the topics that we've looked at in terms of, carpal tunnel exercises, different stuff to get the wrist moving. Of course, any feedback and any suggestions are definitely welcome, so we can start to make more tailored videos if you guys would like. And as always, we would love you to like and subscribe this video to enjoy more content from our channel.